How can I get bioidentical hormone replacement therapy? Where can I get it? Hey, welcome back to the Gutsy Gynecologist Show. Oh my gosh, I need to give a shout out to TJ at M, who left me a 5-star review. Says hugely informative. This podcast has given me so much information I was lacking to make good decisions about my own health. I was in the dark about so many things going into perimenopause. Thank you, Dr. Tabitha, for shedding light on the things we need to know to understand the changes in our body. Oh, I love that. You are so welcome. That is exactly why I do this. I want you to understand what the heck is happening, right? You're not getting the answers or the explanations. And sometimes you're not only being dismissed, but you're being gaslighted. You're being told you're crazy, that what you're feeling isn't from your hormones. I hear all kinds of stuff because I see women all over the country as patients, and the stories are the same. It doesn't matter if you're on the East Coast, the West Coast, wherever, like there's a huge gap when it comes to conventional medical training. And I know because I was there, I had to go and seek out this training and this understanding to really know what the heck is going on with women's bodies. And I'm an OBGYN. There's a huge gap, I promise you. So I'm just trying to bypass your doctors and give you the information, because that's a broken system and it's going to take a long time for things to change and to be able to even penetrate that world of diagnosis and disease. I'm here to bring you health and wellness and vitality and reverse aging and all the good things, right? I have a grandson who's going to be 6 next month. So I just feel like I'm getting younger and better with age. As my biological number goes up, that's about all that's changing. So that's really exciting. And it's because I have studied hormones and functional medicine and taken this integrative approach to really understanding what the heck is going on with my body. And I'm here to share everything with you. You should not be in the dark. I'm excited to hear women say, I finally feel like I'm not in the dark anymore. So thank you. Okay. We need to talk about hormone replacement therapy because I keep getting this in my social media feeds. How can I get bioidentical hormone replacement therapy? Where can I get it? You can get it anywhere, okay? The provider is your limiting factor. Bioidentical hormones are standard prescriptions. Yes, they can be made as compounded prescriptions, meaning they are made specialty with special doses in special ways at a compounding pharmacy who makes drugs. But you can also get them as a standard prescription from your local drugstore. They don't come in as many doses or forms, but you can get them. And for a lot of women, that's all you need. I personally am on 2 standard prescriptions of bioidentical estradiol and progesterone. Okay, so let me just help you understand that you can get your prescription from Walgreens and CVS or wherever you go. Okay, estradiol is a patch that you can get that's bioidentical. You can get estradiol vaginal cream. You can use estradiol gel. Those are all standard prescriptions. There is estradiol oral pills. I do not recommend those because your body turns it into estrone like 70 to 80% of the time in your gut before you even absorb it into your bloodstream. So when you take that pill, you're getting too much estrone. We don't want too much estrone. We want it to stay estradiol. So bypassing the gut, going through your skin is the best way to make that happen. Progesterone is a bioidentical progesterone. You can get that in a capsule form in the pharmacy. It comes in 2 doses, 100 milligrams and 200 milligrams. It is made with peanut oil, so if you have a peanut allergy, you cannot or don't want to take that. And so that's where compounding pharmacies can be handy. They can give you different dosages that aren't available in standard prescriptions. They can make things without the peanut oil base. They can make your estradiol creams without alcohol bases like polyethylene glycol. Some women find that estrase vaginal cream, which although is bioidentical in a standard prescription, sometimes can dry them out and make their vaginal dryness worse. Not everyone. I would say it's about half and half. For those women, we can get it compounded with a different base so that you don't have that issue. So there's all kinds of options. The key limiting factor is your provider. Are you seeing a doctor who knows all of this, who has been trained to prescribe all of these different options? Very often, I get women who have gone to a quote unquote hormone expert, and their only option was a pellet. And so they were getting estrogen and testosterone pellets and maybe a progesterone capsule if they had a uterus. Um, but the doses were too high sometimes, and they didn't offer them any other alternatives. So I would definitely recommend you find a provider who has been trained in all the different ways of prescribing hormones, who understands the nuances of them all, how to test and monitor your levels with the different types of hormone replacement. Um, we're out there, I promise you. Myself, I have a team with nurse practitioners and another doctor. We see women all over the country. We can absolutely help you. So the best way to get in touch with us is to go to drtabitha.com. You fill out the form and you just have a call with my team and we'll help you decide, can we help you? Do we have what you need? What are your issues? And we help women all over the country with their hormone replacement therapy. I never prescribe synthetic hormones. Sometimes I get asked that as well. I just don't. I'm usually taking women off synthetic hormones. We're transitioning off birth control pills or hormonal IUDs, things like that, and finding a natural, safe alternative. So that's what we are doing all the time at Her Higher Health. That's the name of my Dr. Tabitha medical practice. And we would be honored to help you through this journey. So check out the website. You can see if we're licensed in your state to help you. And honestly, some women, if we're not licensed in your state, will just see you as a coaching consultation and help you understand your needs. If you have a local provider who's willing to work with you and just needs some guidance, sometimes we'll do that. We'll be like, in this scenario, most likely this is what would benefit you. And then you can have that conversation. It can start the conversation with your local provider and get you the help that you need so that you can get your hormones balanced. So I hope this answered your question. Thank you so much. Keep bringing me the questions. That's why I'm here. Don't forget to leave me your review. I want to hear from you. Use your voice, okay? All right. Have an amazing week.